Obviously, we know while we're here what's happening all over the country, unfortunately, what's happening here in New Jersey. And now it is hit home here in the city of Newark. Up here we have Dr. Wade, who is our director in our health department, Dr. Elmer Hall, who's over at University Hospital. The county executive is with us, the council people here, Assemblywoman Tucker, our business administrator is here as well, Victor Cirillo from the Housing Authority, Roger Leone, Newark Public Schools. So we're all together and talking about these issues here because it affects all of us in one way or another, some more than once. Dr. Wade will talk particularly about the cases that we have in the city of Newark. Dr. Elmer Hall has something that he would like to talk about as it relates to University Hospital, and then I'll end talking, the county executive will also speak right after me, and then I will end discussing the executive order that we're putting out as related to the new events and circumstances that have just happened here in the city of Newark. So with that being said, the county executive can come up.
Thank you, Mayor. You know, just to give a report on Essex County as a whole, right now we have 11 positives, 2 from Nutley, 1 from Maplewood, 2 from Bloomfield, 2 from Milburn, 3 from Montclair, 1 confirmed from Newark. At this time we have 11. You know, the numbers from yesterday to today has doubled, and there's no question the numbers are going to get higher and higher, especially within the next 2 weeks. I called the commissioner up this morning of the state, and I told her we need to get these drive-by testing, that I would like to see 2 in Essex County. I know Bergen County has requested 1, but I'd like to see 1 in Newark, of course, and 1 in West Essex, because we're never going to get a handle on this to exactly we know how many actually are positive. And the thing that scared me the most yesterday, you could be tested. You could be tested and you could come out negative, and then 2 days later come out positive. So I'm urging the state to work with us. I know they're working hard. It's been a great relationship. The governor's been doing a great job. All of my municipalities in Essex County are working together as one team with all the health officers. And Newark has been very proactive, and I appreciate the mayor and everything he's done and all the work he continues to do with his and his team, because we're 22 towns, we're 1 county, we're 800,000 people, and that's where the priority is.
Dr. Wade.
Good morning. Just would like to report to you that Newark has now gotten a confirmed case that is for sure. It's a male in his 50s, and he's being self-quarantined, is asymptomatic at this particular point. There is another case that we are less than 18 hours into our investigation of it, of an individual who has tested positive. We're not sure if that's a Newark resident, so we don't have any information about that individual until we complete our investigation, but we are diligently pursuing that. Okay.
So I just want to, before I bring Dr. Elmer Hall up, I want to just reiterate what Dr. Wade said. One, we do have a case in Newark. I know there have been many Newark residents who somehow believe the kind of mythology that it would not come to Newark, but it's here. We have a resident who, in fact, is tested positive for coronavirus, and as Dr. Wade told you, is being quarantined, but it is asymptomatic. And prayerfully, the person will get through this to the end. It's important for us to follow everything that folks are telling us to do. The second person is under investigation now. If you feel sick, you should stay in the house. You should contact your healthcare provider. You should stay in the house for 14 days, self-quarantine. You should practice social distancing. The city put out a message saying we should not have any events 250 or more. Even though people aren't having events, if you're having events, you should cancel them. If there are events that you plan on going to, you should not go, and urge the people that are having them to cancel them as well. You should rethink your plans of going out in the evening to bars, to clubs, to parties. to social gatherings where people are, bunched up in one small location. You should not be at those places. You should be home. If you feel like what you need to do is do whatever you can to stay in the house, is what I want to say. Do not go out and participate in all these events where you know there are going to be crowds and crowds of people at. And when you go to the hospital, we need you to give all of your information. We need you to give your name, your address, your phone number, right, where you live, and an emergency contact. We need you to give everything. And if they tell you to self-quarantine, you need to stay in the house. Even if you do not feel sick, you should stay in the house anyway. Even if you don't feel sick, you should stay in the house anyway. You're not a doctor. You're not a healthcare provider. Allow the health professionals to take care of this situation, and we can get through this. There's no way we're going to get through it individually. We have to get through it all together. The last part of that is I know the superintendent has closed schools, until the 30th of March. That means that we expect our students to be home doing their work that they're getting from their schools. Schools will be open to give you breakfast and lunch. There's places that are set up. People know that. But we expect the community, the parents, and the collective businesses or whoever to work together to make sure that our kids are inside, are indoors, that are doing their work, that they're being monitored, and that they're not out possibly causing themselves harm and causing others harm as it relates to this coronavirus. So we want you to stay in the house. We want you to do the work that you were supposed to do, and prayerfully we'll all get through this. Dr. Elmore.
I want to thank the mayor, county executive, council president, Dr. Wade, and all the other incredible officials who support our hospital every day. I want to announce something with regard to University Hospital. We do have a healthcare worker that has tested positive for COVID-19. That is most likely to be a community-acquired case of COVID-19. In other words, acquired outside the hospital. The person became symptomatic and self-quarantined on the evening of March 6th. As soon as they felt symptoms concerning for COVID-19, they did the right thing, called us. We asked that person to stay home, come to our clinic area and get tested. We just got the test results back yesterday. We have since notified staff, all who were in contact with the healthcare worker, who are now under self-quarantine. All of them will be tested at the direction of the Department of Health. We are also in the process of notifying patients and their providers who may have been in contact with this healthcare worker. This is an ongoing investigation. That process is not yet complete. As I said before, yesterday is when we first were aware of the positive test, so that will take some time. The county health department that is assisting us in this is Bergen County. That is where the healthcare worker lives. And so if anyone has questions about that particular public health side of the investigation, should be directed to the Bergen County Department of Health. University Hospital remains a clean and safe place for our patients. As I've told you, we have taken control of this situation. We have taken all of the healthcare workers who may have been in contact, to our knowledge, outside of the hospital, and they're under self-quarantine. We're taking this very seriously. We need to and will continue to serve the community throughout all of this. We are the public hospital for the city and for this region, the Level 1 Trauma Center, the place where so many people depend for their care, and that will continue, of course, taking the cues from Newark Department of Health and the State Department of Health for the public health investigation. Thank you.
Before we get into the questions, I want to take this opportunity to talk about an executive order that the city is going to, that I'm going to sign before we get out of here, that specifically, first, before that, I just want to thank what the county has already done around evictions and around making sure people are secure in their homes. Thank PSE&G for not turning people's electricity off during this time period as well. But our executive order speaks about putting a moratorium on rent evictions and extending the due date for tax payments and fees that will be waived during this time period. We're also going to continue to suspend water shutoffs in the city as well. The moratorium specifically addresses folks who have been affected by COVID-19, either directly, they're being quarantined, or because they're caring for people that are also being quarantined and they cannot go to work. They have to stay home, and they may have to stay there past the days where their job is prepared to pay them for. So we are trying to put a moratorium on rent evictions here in the city. I know the state, they're thinking about doing some things as well, and prayerfully we'll all be on the same page soon across the state of New Jersey. So that's what the executive order is about. I know I'll sign before I leave, but I know there's a host of questions, and I don't want to interrupt that. Allow you to ask the questions now before we go into that. Yes. Go ahead.
Just to be clear, you're urging all residents to stay home no matter what?
Well, what I'm saying is if there's no necessity for you to come outside, I think that you should be in a house. I also believe, and basically as it relates to being in mass situations, right? Obviously, if you need to go to the store, you need to go to work, you need to do your daily routine, then deal with the daily routine. What I'm asking people to do is not be in large crowds, in large gatherings with individuals, parties, clubs, bars, nightlife entertainment, art shows, whatever it is that the city usually has in and around the city, even outside of the city. We urge people not to participate in that.
Mr. Mayor, Brother Ellis, Local Talk News. Where can people in the city go to get tested?
Well, you can only be tested at a healthcare facility, but I'll let Dr. Wade talk about that. Go ahead.
Sure. Anybody who has interest in being tested should contact their healthcare provider. That can be their private doc, that can be a clinic, it can be a hospital, but we're urging people not to use hospitals unless it's absolutely necessary, okay? And know that there are criteria for testing. Though we now have the availability of testing through private labs like Quest and LabCorp, we do not have an unlimited supply of tests. So we have to be stringent in how we administer tests, and so by contacting your healthcare provider, you can then have that discussion with them over the phone, and they can give you guidance whether it makes sense for you to come in or not. However, if you are having mild symptoms like you did 6 months ago, stay home. If your health starts to worsen and you become concerned, again, reach out to your healthcare provider. It will require a healthcare provider's order in order for you to be tested.
Yes.
Follow-up with Dr. Wade. There's been reports of residents who've gone for testing who felt like flu-like symptoms, tested negative after a hospital or health care facility for the flu or threshold, but not given a coronavirus test as soon as they had the 19 test because they weren't in the demographic of highly likely. What's the recourse for those residents?
Well, again, most people who have flu-like symptoms, cold symptoms, don't feel well, are not going to be positive for coronavirus, right? So that's why the medical interaction is important, either by call and discussion, and or if your healthcare provider tells you, yes, come in, then call that place ahead so that when you get there, we can hand you a mask upon entrance so that it will minimize, if you happen to be one who indeed is infected, it will minimize spread. So, right, so we've tested in Newark 21 individuals, okay, that with only 2 positive. But again, that 21 are those who the tests went to the state and then to the CDC. But now over the past week to 10 days, as testing has been availed through private labs, we don't know how many have been tested because that data is not initially entered into the state's system. But again, the take-home message is to don't be overly anxious, okay? If you feel cold, flu-like symptoms, stay at home until or unless your symptoms worsen and or you become concerned, but contact your healthcare provider because that's where the determination will be made whether you are viable for a test, if you will, okay?
Thanks for the question. We have been preparing for this since the problem was isolated to China, knowing that this could have and ended up turning out to be a pandemic. That includes shoring up all of our resources, supplies, having a surge plan. In addition to that, we've also run mock drills through our emergency room with folks suspicious of the symptoms associated with coronavirus from high-risk areas, learned from those 2 mock drills a lot, and improved our processes over time. So it's us, but it's not just us, it's the entire healthcare system in New Jersey that has been preparing under the leadership of the commissioner and the governor. That's been the instructions we've all received, and so we've been preparing for months now for this. Thank you.
Yes, I got you. Yes. Yep. The superintendent, that's not his purview. That's county elections, right? He can't determine whether the elections are not being held. Right now, it's being scheduled. It's on schedule as normal. Yeah, it's on schedule. Yeah.
What you said earlier, have you or your staff members talked to the governor's office in terms of that mobile testing that you want here?
Yeah.
I spoke this morning to the commissioner, and they're trying to do one right now in Bergen County, putting it together, and I strongly recommend that we have one here in Essex, possibly 2 in Essex, one here in Newark, of course, and the other one in West Essex.
Yes.
Question for you, Mayor.
Mhm.
Are you in talks with your local businesses about any plans to impose a curfew? Or, your fellow mayors in Hoboken and Jersey City have done that.
Yeah.
Is that on your radar too?
Well, it was just brought up just a few minutes before we came down here, in fact. So we're contemplating that, but, at this point, we have not, said that. Jersey City and Hoboken is a little different than Newark, not much, but a little, in terms of their nightlife. Obviously, if we say close at 10, doesn't mean they can't contract coronavirus at 7 or 8 or 9, right, or 6 for that matter. What we want to really say is stay away from large crowds. I think that's the smartest thing to tell people. Stay away from large crowds, practice social distancing. You go to a bar, if you see a crowded bar, pick another bar, right? If you go to a place and it's 250 people in there, don't go. As a matter of fact, cook at home, right, if you can. That's what you should do. And that's what we're asking people to do at this point. Yes.
The superintendent, can you give us a sense on how the online instruction, how that's going to take place, and how smoothly you think that's going to go? Maybe your message to parents in terms of helping with that.
Thank you. So currently, the learning at home plans became online on Friday. The classes that the students are responsible for begin on Monday, and we're expecting them to return back to school, at least right now, tentatively on the 30th of March. Even though the question with regards to the school board elections was already answered, I do want to take this opportunity to remind everyone that it is scheduled for the 21st of April, and I do need our citizens to vote yes on the budget. Thank you.
Yes, sir.
Two questions about schools and families. One is for families that now work at parents that their kids are going to have school, is there any thought about childcare or if they have to stay home, helping with their pay and things like that? And then second of all, if they don't have internet access at home and you want to get online to work with their kids, is there any support for families getting a wireless hotspots?
So so in terms of pay, most jobs, and I know in the city, we are allowing people to take those days, and that's why we talked about extending that. So the days they may be able to take probably 10 days that they're allowing people to have for the most part, which is why we went the rent moratorium, why we're doing the issue about the taxes, why we're doing the issue about the foreclosures, all of those things to provide relief for parents who are not getting the resources that they may need or have to use those resources on food and different things like that if they're being self-quarantined for 14 days. Some schools, not Newark Public Schools, some schools in Newark have their kids out for 30 days. That's a right or wrong, that's a discussion, it's somebody's judgment, but at the end of the day, those parents are being in those situations, and so I think it's incumbent upon us, as leaders to create opportunities for these parents not to become homeless, not to hurt them in this situation. So we're going to provide as much as we possibly can. The city is not New York City. We don't have billions and billions of dollars in our budget, so we can't provide relief to small businesses, to families, to do all these other things that other municipalities have the ability to do. I think the state is thinking about some of these issues. I know that the state legislature is thinking about some of these issues and are putting some bills on the floor. Prayerfully, they'll get passed and sent through. And I know the governor himself, I spoke to the governor as late as this morning, is thinking about some of this stuff as well. So that's why I said earlier, sooner than later, we'll all be on the same page and we'll be able to put out something that everybody could benefit from.
Yeah, in reference to Essex County, we have 3,500 employees, and we want the parents to be with their children. So what we're doing is allowing anyone that has a child, whether it goes to our vocational school or any school throughout Newark, throughout Essex County, they'll be able to stay home with pay.
The part about the computers, so the city facilities, I hate to say it, will be open in terms of the rec center, the library, all of those things. We just don't want piles and piles of people coming there. But they're there. As a matter of fact, we are in a process of cleaning every city building. The city is closed down on Monday, so we can finish doing the cleaning. We started cleaning Friday, Saturday. We're cleaning some stuff up even today. And tomorrow we'll be cleaning. City Hall will be closed. The municipal court will be closed. Everything will be closed so we can do the cleaning that's necessary. And the municipal court is closed for a certain amount of time. So people who, for 2 weeks, I believe, people who have issues in the court, those things will be extended beyond those 2 weeks. Yes.
The mayor mentioned about the county with the evictions, the foreclosure, and the sheriff's sales, what we've done as far as postponing that. The other thing is with our jury, we are the largest judicial system in the state of New Jersey. We met with the assignment judge, and they're postponing any new case. But people that are on a case right now, which is very minimum, of course, they'll continue. But there will be no new jurors that will be coming to our courthouse.
Our federally qualified healthcare center will be open, though. Everything else will be closed, but the healthcare center will remain open. Just wanted to make that clear, so folks that have to go there should go there and continue to go there for their appointments or checkups or whatever it is that you have to go there for. So I'm going to sign this executive order. If there are no more questions, and get out of here. Again, the executive order speaks directly to a moratorium on rent evictions to those folks that are affected by the COVID-19. It also extends 60 days for you to pay in terms of taxes and waive all fees around taxes. And it also extends our no water shutoffs in terms of people who are delinquent in their water bill. So, thank you.
I'm sorry, can I ask one for Dr. Wade?
Yep, last one, brother, last one.
You mentioned there were 21 people tested in Newark, but 2 had been positive. Can you just clarify that?
Yes, we have tested, the Newark community, medical community, has tested and sent to the New Jersey State Lab 21 tests, which then have gone to the CDC for confirmation or negative. Of those 21, only 2 have come back positive. Again, because now testing can be done by medical entities without sending those tests to the state. It doesn't mean the 21 is the total, but that's the total that we're able to keep track of at the moment.
So the Newark test, 2 have come back positive.
Beg your pardon?
Of the Newark test, 2 have come back positive.
Two have come back positive, right. And again, one we shared and the other we're at the beginning of investigation. We'll have follow-up later on that.
So I'm going to sign this. That sounded a little confusing, so I hope everybody's clear on that, right? The last one. We have one confirmed case that we know is in Newark, right? There are 2 people that were tested, right, who came back confirmed. We don't know if the second person is, in fact, in Newark. So that's why we're saying 1 in Newark. We're investigating so we can make a determination if that person is, in fact, a Newark resident. Right. Thank you. Thank you. Appreciate it. Thank everybody for coming.